Hey, Dr. Bruce Stevens again with Woodstock Health Institute. I wanted to give you a quick little analogy to shed some more light on this neuropathy problem that so many people are suffering with. To do that, I have this wire. This is just the basic Category 6 communication wire, and I've stripped it to make one end exposed, and let's pretend this is the brain, right? And then the wire represents the nerves, the nervous system, all the way down to, let's say, your feet. All these little nerve endings go to different places in your feet. So how this works normally is the brain sends messages out each one of these little wires down to the body part, in this case the feet, and messages can also travel from the feet back up to the brain to tell you what's going on. So like, let's say the blue one represents cold, and the orange one represents hot, and the green one represents pain. The other colored one might represent vibration or light touch, different things like that. So each one of these nerve endings has a job to do, and when it's stimulated, like if the hot one's stimulated, the hot one in the brain lights up and it tells you that there's something hot on your foot or a pinprick or whatever. With neuropathy, what we've discovered is that there's damage to the blood supply to the nerve, and that actually damages the wrapping around the nerve. So it's like this wire has a sheath around it, a sleeve, to keep it insulated properly. But with neuropathy, over the 100 different causes can create damage to the wrapping and the blood supply around the nerve. So what happens is that wherever that damage is can be a source of irritation, almost like a short circuit like we'd have on this wire. And that can cause these nerve endings to feel like they're being stimulated. So you'll feel in the brain pain, or like when you go to sleep at night, you might feel pain, or you might not feel the hot pavement that you're walking on, and it may burn your foot because that nerve is being irritated or damaged there somehow. So this problem can be fixed through our course of care. We try to repair the situation and get the body to actually stimulate healing and growth back into those blood vessels so we can return that back to normal, almost like we're fixing a short circuit. And then everything gets back to a better functioning position. So I hope that helps to demonstrate the different kinds of nerve endings and how that whole process works. When you come into the office, we're actually going to test a lot of these different nerve endings by adding stimulus like cold and fine touch and vibration into the body part that's affected to see if we can identify which one of these might be affected. So we look forward to seeing you soon, and I hope that helps to illustrate this complex problem of neuropathy.